Trump laid out what he wants to do with health care at the debate last night. Let's listen.
Obamacare is a disaster. You know it. We all know it. It's going up at numbers that nobody's ever seen worldwide. Nobody's ever seen numbers like this for health care. It's only getting worse. In 17, it implodes by itself. Their method of fixing it is to go back and ask Congress for more money, more and more money. We have right now almost $20 trillion in debt. Obamacare will never work. It's very bad health insurance, far too expensive. And not only expensive for the person that has it, unbelievably expensive for our country. It's going to be one of the biggest line items very shortly. We have to repeal it and replace it with something absolutely much less expensive and something that works, where your plan can actually be tailored. We have to get rid of the lines around the state, artificial lines, where we stop insurance companies from coming in and competing because they wanted, President Obama and whoever was working on it, they want to leave those lines because that gives the insurance companies essentially monopolies. We want competition. You will have the finest health care plan there is. She wants to go to a single-payer plan, which would be a disaster, somewhat similar to Canada. And if you ever notice, the Canadians, when they need a big operation, when something happens, they come into the United States in many cases because their system is so slow. It's catastrophic in certain ways. But she wants to go to single-payer, which means the government basically rules everything. Hillary Clinton has been after this for years. Obamacare was the first step. Obamacare is a total disaster. And not only are your rates going up by numbers that nobody's ever believed, but your deductibles are going up. So that unless you get hit by a truck, you're never going to be able to use it.
Mr. Trump,
it is a disastrous plan, and it has to be repealed and replaced.
Okay, so he spoke for a while there. There are only two ideas that are embedded in that and two policy things you can ascertain from that. So it's classic Trump, ramble on and on and on and on, and people got to try to find the nugget of any policy if there is policy in what you said. So the policy is get rid of the lines around the states. I love how in the mind of the far right, that's the cure-all for healthcare. Just get rid of the lines around the states. What are you talking about? Just get rid of the lines around the states. And what they mean is let health insurance companies go to whatever state they want to go. And they think, oh, this will increase competition, so it'll be better and prices will fall. What'll actually happen? All the health insurance companies will simply move to the state where they pay the lowest state tax and set up shop there so that they can save money and pad the bottom line and make more profit. That is the only thing that will happen. If you allow health insurance companies to, move along to wherever state they want to go and people can buy across state lines. That's the only thing that's going to happen. So that's a massive, gigantic giveaway to the health insurance companies as he's pretending like, no, this is going to improve your health care. No, it's not. No, it's not. No, it's not. Now, the other policy thing we could take away from this is he says, Hillary wants single payer, bad, sad. Okay, no, she doesn't. I wish she did. She wants, maybe, at least she says she wants, I don't even know if I believe it, the public option. Better than what we have now, but, again, I don't know if I believe her that she even wants that. But the idea that single payer is bad, okay, according to every study done on this, the single payer healthcare systems around the world repeatedly rank as the best systems in the world. So no matter how much people on the right try their best, oh my God, I'm going to, try to will my stupid ideas into reality, they are just not true. All the time, the single-payer healthcare systems rank better. Guys, in the United States, 45,000 people die every year because they don't have access to basic healthcare. Basic healthcare. What's that number in Canada? 0. What's that number in France? 0. What's that number in Britain? 0. What's that number in Australia? 0. It doesn't exist because anybody can get basic health care. Now, he's complaining about wait times. What's he not telling you? The wait times only apply to elective procedures. Now, don't get me wrong. If you want an elective procedure, that can be pretty fucking annoying. But what does that mean? It means that they are prioritizing based on actual need of care. Whereas here we prioritize based on who's rich. which is why it's actually true that you have like Saudi fucking princes coming here for healthcare, because they're massively rich. So if you're super rich, yeah, we have the best healthcare in the world. If you're middle class, no, you don't. We actually have one of the worst systems in the modern world. If you're poor, oh, forget it. So those are the only things you could take away from what he said. His idea is to get rid of the lines around the states, which wouldn't do anything but help the insurance companies, as he pretends to be against that. And single payer is bad, which it's not. It's great. And then just the idea of like, fuck Obamacare, it's bad. No, Obamacare is a massive mixed bag. In many ways, it is bad, and there are gaps in it. There's a gap between the Medicaid expansion and where the exchanges pick up, and there's a gap on the higher end of the exchanges. But yeah, it has been very good for a lot of people, and furthermore, yes, costs are going up, and that's bad. But that disregards, we don't know what the cost would have been if it wasn't in place. It very well could have been more, and it was on the trajectory to be more. So totally unnuanced view of the world here. And by the way, final point, he goes on to say later on, a plan that he would do would expand Medicaid. You know what expands Medicaid? Obamacare. Obamacare's so bad and so terrible, it's horrendous. Let me just tell you, believe me. I say we repeal it and replace it with Obamacare.